Hey guys, welcome back. It's a new year, it's a new season, it's a new me, it's a new you. I'm Angel Martinez, the host of It Hurts to Be Pretty podcast.
And I'm Lexi Wilk, the co-host, and it is a new us because we are on a weight loss drug and we're going to talk about it.
She just went straight for it. I don't even have to wait for the anticipation.
The episode title is going to be called...
Yes, I fully admit it. I actually will be doing my dose later on in the podcast. But first, we want to introduce our guest, our very lovely nurse, Nurse Maeve. Welcome back.
Thank you, guys. Glad to be here.
You look so pretty, and it's your birthday.
Yes.
Happy birthday.
Thank you.
Cougar.
I was proud.
46 and proud. See, now we're officially the same age. Cougarville is a thing. She showed up to our Christmas party.
So slutty and hot.
Slutty and hot. She had the thigh highs. I said, what Christmas party are you going to?
Those are PJs. That's what she was about.
I was.
They were cute.
It's that
long, so hot.
So she inspires me to be a little sexier all the time. But welcome back, because we are talking about this topic, and we didn't avoid it. We just been busy all year. Yeah. We brought it on probably, it's been about a year or close to it.
Has it been a year?
Close to it.
Oh, damn.
And so, you know, tirzepatide, the quote unquote weight loss drug, there's Ozempic, there's semaglutide. And I'll be the first to admit, because this is, you know, the tell-all, if you will, but I was not against it. I just was like, you know what? And Lexi could admit to this, because I was pretty upset that people were doing it, and they were just getting super skinny. Because back in the 90s, you remember this.
Yes. Being
skinny with no body, no tone, being just frail looking was in. That was like no butt.
GNC was thriving.
Yes.
That's really good.
Yeah.
Sure.
So like that was, and it was labeled as like you having a Coke body.
Yep.
It was in. So I felt like history always repeats itself, and now having a skinny, frail body is back in, according to some people, right? But I was like upset, because I like being a little softer. I love being not so tiny. I have a big head. So like if I get too skinny, right?
We're like Angelina Jolie with a big head.
Yeah, I look very alien-like.
Mm-hmm.
Okay, so I decided to bring it on because I felt like people who follow us, who come to us, they needed help losing weight.
Yeah.
Okay, I'm just briefly saying my story real quick. I've been working out since 2020, at least 5-6 times a week. I do the treadmill at least 3 times a week, where I pick up my cardio, and I could not lose like my 10 pounds that I was always wanting in my belly fat. So, and then I have a side pain, which we feel is linked to inflammation. And I've always had chronic pain. My daughter's here, she could testify to this. I used to hold my stomach. I used to wear the fajas to keep it in, so that way it wouldn't get as inflamed. If I did a hard cardio day, this would puff out. And I'm saying all this to say, if it's relatable in any way, because you're not alone, and being perimenopause.
Mm-hmm.
So you factor all that in, but I was like, I'll never get on that drug. That's so dumb, and you'll never catch me doing it. And here I am going to get my 5th dose and I've admitted to my daughter, I took her out for a drink. I'm like, I have to tell you something. And her whole face dropped, because I hide nothing from her, you know. I have to say, I've lost, I think 10 pounds. I lost 2 prior to getting on, and then I lost 8 pounds on the month.
I think you're just shy of 8. Mm-hmm.
Yes. So for me, it's not a whole lot of weight. I don't want to lose. I like my booty. Yep. I don't want to lose too much of my booty, but I feel better. I feel less puffy. I saw my picture. You know, I do 9 News every Thursday, and I'm always looking at my side profile. I was snatched this weekend. I was like, who's that? Ooh.
Yeah, I lost a little in your face.
I lost
and I think a lot of people do. That's like always, you know, I see it when they come in every week, where I'm like, you're starting to look different, you know, and the face can be a real tell. And yeah, when you have a little bit of a bigger head, I also can attest. I'm always the extra large cap size, is that it is, you know, it feels great when you start losing it in your face, where you start to see it in your pictures and everything. It's awesome.
Yeah.
Well, you were mad at me
I was just going to say that.
I was the first one in the office to get on it before we even started carrying it, maybe?
Yeah.
Because I worked with my functional practitioner in California.
Right.
So I had a really severe chronic illness, and it caused me to not be able to eat for like 2 years, basically. Super frail, super unhealthy. So the second that I was able to eat again, I was just retaining weight. I felt like shit. I was in pain. Yada, yada, yada. But since starting tirzepatide, it's like...
Yeah, a big added benefit is the inflammation. There's a lot of other things that we're discovering improve when you're on this, and the inflammation and, you know, people with gut health, people with PCOS, things that affect our body and our whole health. There are benefits to this drug where it's not only about weight loss, but an overall function of inflammation too. It's kind of amazing.
Which I feel as women, we do carry a lot of inflammation in our gut, in our face. Maybe it's stress, maybe it's thyroid, maybe it's, you know, with Lexi, like she said, when she got on it, I was upset. Gabby can testify to this. I was mad even when I got home because, you know, I love Lexi and I know she's OCD and she's all these things that make her Lexi, but I thought this was another like she's going off on it. She's so tiny to me, right? When you look at someone who is bigger than you, you're like, oh my God, you don't need this. I'm bigger than you. And how come, you know, like what do you think of me kind of thing? Or what do you think of other people? But as I learned more about Lexi and just, you know, if you've seen Lexi's pictures in the past, she was slightly overweight. And when I say overweight, she had a little gut.
Did it well.
Gut and butt. She did. But it wasn't anything bad, right? It wasn't anything alarming. She also, she doesn't work out as much too. She has not created that habit. But listen, when she told me this, I was upset. I was angry. And then I was like, we're carrying it. She's not allowed to do it because I'm that mad at her. Because I felt like she was tiny and I'm like, how do you not see what we see? And I thought she was just doing it for that. Now, when you know more, you learn more and you do better. So I want to say it. I want to say I'm sorry on air because you deserve an apology because I was mad. Like a mom would be mad, right? Like I was just like, what is she doing? And how dare her?
And it's crazy. My mom was the one that wanted me to get on it because...
I was even a little upset with your mom. I'm not kidding.
That's what they do.
I was upset with your mama too. I was like, I'm going to call Dana and have a glass of wine. I'm going to talk to her. I'm going to be like, we need to have a talk. But again, you learn more about the drug and you realize, and I've seen Lexi eat healthy. I've seen her eat during lunch. I've seen her.
I always have eaten as healthy as I do now. Yeah. But my hormones just were not functioning properly.
Yeah.
So that's another thing. And we'll talk about it.
Yes.
Nutrition is so fucking important.
Absolutely. If you want to be successful at it, it's what you do to change. It's what you do to change your habits, your eating habits, your workout habits. What you want to put into the program will lead to the best outcome. And that is, I can look at someone and be like, you're either going to fail or not based on if they have the goal of changing their lifestyle.
Because the second they get off of it, they're going to revert back to their old nasty habits, right?
That's the number one thing. Is this about changing your habits? Is it about changing your lifestyle? Or is it like you're expecting a quick fix? And I tell everyone this isn't a quick fix sort of thing. Although it's great to add in an adjunct treatment, that is not what it's about. If you want to change your lifestyle, you have to commit to it. Yeah. And you can't cut corners. Right. You can't just starve yourself. You have to incorporate food. You have to rethink what is good for your body when you're eating, and you have to really notice things and make people journal and make them really look at things, because that's when they start being super successful in it. And that's when I just see, you know, like you said, it's like, oh, Lexi had just a little bit of weight she maybe could have used. You know, we're women. We have like a 3-size run, right, of where we live.
Yeah.
I got my
jeans.
Sizes when I'm
We had the comfortable jeans.
Yeah.
And I still do.
And those skinny jeans we're always trying to get into, you know, but it's what you feel like. That's the most amazing thing. And how many people come in and say, I'm not telling anyone. I don't want to say, I don't want the judgment. I don't want anyone's opinion. I'm doing this for me. But it's how you feel on the inside. And when I start to see that change, man, this has been like such an amazing program to watch people change. Like it's so rewarding to go on the journey with people. It's awesome.
I mean, you've seen people cry. I mean, on a different level,
emotional.
right? Because we do have all ages, ranges, and weight, levels.
100%.
So like it could be someone who's perimenopausal, and then you have someone who's been overweight for most of their adult life.
Yep.
Which, listen, I know I get the whole body positivity thing. Great. This is what's good for you personally.
For health.
100%.
Because health is so important. And I'm sorry, eating like crap, and Gabby can say, I used to have hot Cheetos, Doritos, Funyuns. We had cookies. We had it all because it was just a habit. It was cheap. I was a single mom, and it's just, you fed your kids snacks and it was easy.
Yep.
Now you go in my pantry, there's like walnuts, and she hates it. It's very, I don't cook as much as I used to, but it's just like, I try, because if I see it, I'll eat that way.
I can't have a bag of chips in my house unless I plan on taking it down in one day. It is way too dangerous. I know my danger zones, you know.
But let's just start briefly. What is the drug? Like, what is it? And we carry two different options, tirzepatide and semaglutide. Lexi and I are on tirzepatide, which is the more expensive one. Can you please tell us what they are? And what's the difference?
So we have two different drugs. We have semaglutide, we have tirzepatide. These are the name of the drugs. We have name brands like Ozempic things, but it's actually the type of drug. We have two different ones. Program semaglutide starts at $400 a month, tirzepatide $600. So there is a price difference. But what these drugs do is they communicate to your brain, your GI, and your endocrine system or hormone system to help with weight loss, to help control the feeling of hunger and slow down your GI. But they do directly target those things. So there's other benefits, right, to your brain, your hormones, and your gut. What they are is replicated from a natural hormone we secrete in our body. So GLP-1 is the semaglutide, and then a GLP-1 and a GIP is a tirzepatide. So that's two different types of hormones in our body talking about to our gut, and when we're hungry, they communicate. What we're doing is replicating those to help with your feelings of hunger, help with how fast your body digests food, and controlling chatter in your brain essentially too. So it's fantastic. But we have a lot of other benefits, like we said, inflammation, hormone support, great for us women, perimenopausal, people with PCOS, all things. The drugs are amazing, but what they do is they help all of those systems.
I think if you live with chronic pain, and I can only testify for myself, for the past 18 years, I've had a side pain, and I've had surgeries. They try to figure out what it is. Obviously, it's linked to my ovary. I'm not ready to take out my ovary. They took out my uterus. I have both my ovaries, and they're still functioning. So I was going to leave them in there. However, around that time of the month, or if I eat really crap, it'll inflame and it'll protrude out. And then I'm taking at least 8 Advils a day. And I did that consecutively for at least 10 years. And so my liver was starting to get really bad from all the Advil I was taking.
Yeah, it's so dangerous.
But that was the only thing that was helping my pain. So I can only speak for myself. For the past month, like yesterday, I kind of felt it a little bit, but not nearly what I was experiencing every single day. Lexi has known me for, 6 years or so, 5 years, I don't know how long. And how many times have I held my stomach?
Yeah, you see her do it in the office all day long.
It's just chronic, and I've learned to deal with the pain, work through the pain, and try not to complain about it as much. I just would pop some Advils. But I can honestly say this is the first month I've ever felt like I didn't have to pop Advils. I feel the pain sometimes. Like today I did leg day, and it'll pinch here and there, but nothing what I've experienced. So for me, this has been a game changer. So it wasn't initially to lose a little weight, but I can tell the inflammation in my stomach has gone down just with doing this, because I haven't really changed much of my eating. I didn't eat very much as it is. So I don't want to do the highest dose, and there are different doses for different weight levels, correct?
Yes, absolutely. And we go to the dose that's right for you. It's not cookie cutter with what our goals are. You can have a low goal like you. It's not necessarily weight loss that we're doing, but we're trying to target the inflammation too. So you're perfect at a low dose. That's all we're ever really going to do for you. But then you have people whose bodies respond different, where they'll end up on a higher dose. And it is so personalized. It can't be cookie cutter.
Yeah, I think one of the bigger issues too with people purchasing it online from like the Hims, the Hers, whatever, they come as preloaded shots, right? It's not the compounded type of product we have. So they're getting these doses where they start low week 1 and they increase week 2, 3, 4, no matter what. It's not customized. They have the preloaded shots. So they're jumping from the lowest dose to the middle dose, and it's crazy. They don't need it. They're losing the weight. So I think a huge benefit of doing it in office with a nurse who knows the dosages is going to make all the difference. I can't imagine going up in a dose like past the lowest. I'd be projectile vomiting,
And get really sick, right?
Yeah, a lot of people, how your side effects do, but I'll tell you, side effects are for what I've seen in my patients is directly linked to how compliant they are to the program. When you do something naughty, some greasy food, extra cheese, sweets, carbohydrates, I see people will have triggers that their body, or alcohol, for example, where they're like, nope, no more, I can't do it anymore. Your body is basically cleaning out, like telling you what you want, what it needs. It's no longer, I can just get away with the bag of Flaming Hot Cheetos. I can't get away with so many alcoholic drinks. I can't get away with carbohydrates or sugar anymore. And those are like the biggest triggers. But changing your diet, that's why it's like success on the program.
And not eating enough protein.
Yeah.
How would you say important protein is?
Oh, massively important. What I say, people in my chair will hear it all the time. I'm like a broken record. You need protein, you need fiber, you need water. Protein, fiber, water. Massive amounts of these things. Protein is absolutely
important. I had to get Lexi's, and we should link Lexi's favorite one because that's the one I put in my the Sun Fiber in my protein drinks, because the first week your body goes through a little bit of a change, and I couldn't use the bathroom, and I was like, I felt like I was 5 months pregnant with shit.
You have to keep it moving. Fiber. We need veggies. We need fruit. We need leafy greens if you need to supplement, but I will say a lot of my patients too, we stop with supplements. If you're trying to do protein powders or fiber powders, they start to taste weird to you because your body's literally craving the real thing. It's mind blowing how everyone has to learn that on their own.
Has it been linked to, I thought I read this somewhere, to help with addiction? Yes. So
they're seeing
alcohol, smoking weed, things like that. Because I noticed even for me, and placebo effect, I don't know, I just drink a little less.
Yep.
Last night I had 1 glass of wine, 1.5, I think, and I could easily do 3 or 4. Didn't say I will still not sometimes, like it'll happen, but I just didn't crave it as much, or I'll have every Sunday. I used to have a pint of ice cream.
Sunday.
I always have like a free day, like where I want to eat what I want. But I couldn't even finish it. I had like 3 bites. I'm all, okay, but it helped to just put it away.
It changes the quantity of the things that you eat.
Yes.
It really does. It minimizes things. Even if you do, I'm feeling a little sweet, you'll have a little bit instead of like the whole bag. Like me, a handful of chips is fine instead of the whole bag, It's amazing.
Well, I had the opposite reaction of you. So one of my biggest benefits, there's 2 actually. So going through the severe mold toxicity, the autoimmune stuff, I wasn't shitting. Like there'd be 2 weeks I wouldn't shit.
Yep.
One thing since starting the tirzepatide, I have a bowel movement every day. A healthy, solid, sorry TMI, a healthy, solid shit.
She's doing
it the first time in my life, I had regular bowel movements.
I got patients with PCOS, IBS, things where they're like, their bowels, where I worry. I'm like, you can't let your bowels slow down. I have a rule. If you haven't gone to the bathroom in 2 days, you better be calling me. We're heading to Walgreens for some mag citrate. We're fleeting that out.
Yeah.
And, but it's mind blowing.
Yeah.
This drug.
And you're really great too during the consultations if you see any signs of body dysmorphia, history of eating disorders.
How do you handle that?
Yeah. I address it head on. And as with anything, we're talking about it because I'm not going to, I don't want anyone getting too frail or too sick on my watch. That's not the way I want. And also let's talk about it. But what I see people is when you're in that place where you're not happy with your body, doing something like this, it starts to make you feel better. Then all of a sudden those issues with body dysmorphia, how you're feeling, your low self-esteem just start changing. Yeah. It's awesome. True. It's so rewarding.
I feel like your self-esteem has really improved.
It has.
Yeah.
And the moment where it kind of dawned on me, it was week 2. And normally I always say no to brunch. Like Justin goes with his friends. I never go because I'm like, okay, I can't really eat anything on the menu. It makes me sick. And then if I go, I'm going to overeat. I'm going to eat fucking shit that's going to make me ill for 3 days. So I'm like, fine, we're going to go to brunch. I was able to eat like half my burger and my little fries. And I was like, actually, this is crazy. I can go to social outings now and not stress.
Yeah.
So it feels good. It's freedom, really.
It really is amazing. I have so many people, like I said initially, the GI, the hormone system, and the brain are affected. The positive brain changes that people see, like, I mean, it's super emotional for me in my chair, but I think everyone's beautiful at whatever size you're at. So I will deal with body dysmorphia things straight on, like, okay, let's not do that. We're not hating on ourselves. That's not why we're doing this. But it is what, I have people who are like, I've dealt with anxiety, depression, food chatter noise. People are like high anxiety. They're like, this just made me handle things a little bit better.
Yeah.
One patient's husband said to her, she's like, you're just like a little more reserved. And she's a boss. She like handles a great company, has small kids, great. But he's like, I'm noticing, she's like, I'm no longer everything has to be crisis management. I have like a total step down in my brain where I can just handle it and nothing's going to fall apart. And those brain reactions and changes I'm seeing it's so rewarding for me.
Yes. I love it. I feel like it's still a controversial topic for some.
Yep.
Yes.
But it's always going to be. That's with filler. That's with that's with anything.
It's your body. It's your choice. We're not
judging if you do or judging if you don't. Just do what's
here
right
to
for you.
help, but we're not allowed to go off the deep end either. Never in my chair. We're not going off the deep end.
No, I like Lexi was saying, I'll get some DMs, I'll get things that people don't agree with me, or if I didn't post enough, if I wasn't being sensitive, it's always something. Everyone is especially this day and age, everyone's fragile, right? But I come from New Mexico, and a lot of the children and people there are obese, and there's a crisis there.
Yeah.
So for me, I'm like, I'd rather have people who there's help, there's if this can help change their lifestyle, then their children will see them eat better. Yeah. The people after them, their friends will start to see them make better food choices. And because when I go back home, I get sad that, some of my aunts are overweight or my little cousins are overweight. And that's, before as a society, we're complaining because everyone's too big, right? Mm-hmm. And now it's like, don't be too skinny. And, we associate eating with love. When you come from a Latino family, we're going to feed you if we love you and take care of you. And if you're not eating, you're not happy. And so I think just breaking some of those cycles, because we want to live longer, we want to be healthier. Of course, I love my ice cream and my wine. And I think it's just personal choice. And being educated in this drug has made me change. It's not that I could have gone years, fine. But when I heard that it helped with inflammation, this light bulb went off, because my pain was linked to that. I was like, maybe I'll try it for 2 weeks. I told Maeve, I'm just going to try it for 2 weks.
That's what I said.
Yeah.
Famous last words.
Yeah.
Famous last words. So like just like less than a month.
Yeah. I felt like, let me see if I see. And 2 weeks in, I'm like, oh my gosh, I haven't felt my pain. I don't know if placebo effect, what is going on?
She may not be eating much, but she's eating those words. Kids, eating the words of what she thought before.
Okay, what's the first step if someone wants to come in for a consult? What is the first thing that you have them do?
When you book a consult, first thing, a full medical history form. We've got to go over things. There's reasons why you can't be on this drug. We're going to talk about it. We're going to go over it. You're going to fill it out. You need to be in depth. We're going to go over it together. We're going to make changes if you miss things. And then we're going to start talking about the program, the drug, the food education, everything that you're going to need to be compliant. Mm-hmm. And during that time, I give you the good, bad, and ugly, what the side effects are, what could happen, the good, bad, and ugly. We talk about it all because I want my patients to have time to ingest everything I'm telling them. The severity of using a drug, you have to be fully aware of the things that could go wrong. This is your choice. It's your body, but things can happen. And you need to know what that looks like, because we'll get off the sauce, abort the mission as soon as if we need to. But we go over everything in full. I talk about goals. It's really nice. We do the consult, and then I'm going to send you away for blood work to double check all of the function.
Because you need a few things. Sorry to interrupt you, but you need you can't just come in with, I did blood work last week and, you need certain things.
Yep, we're looking at your thyroid health, your A1C, which is your overall glucose over 3 months, and then a complete metabolic panel, which really shows us your kidney, liver function, all sorts of things there that we look at to make sure nothing's off, nothing's going on in your body. I'll send you away for the blood work. I'll make you chew on everything that I taught you because I fill you full in that hour appointment of a bunch of information. I always say to my patients, you have to be honest with me. There's no judgment in my chair ever. You got to tell me how you're feeling on the drug. You need to ask me questions. Don't wait a week. You're going to be DMing me. You're going to be talking to me about it. And then we can start, as long as you go get your blood work quickly, you'll come back in like the next, week and we'll start the program. The first month, I make you come in every week. Like Lexi was saying, the online options and things, you don't have people telling you about the side effects.
That's what's so scary,
You'll
right?
like glaze over things.
If you're just online and, obviously Big Pharma is going to get a hold of this and see how they can monetize on it. But if you don't have a nurse, there's so many questions, and even during the week,
so many.
We're lucky we have you to what about this and what happens if this. I can't imagine that you're just getting and they're just guessing your dose. They know nothing about you. I'm sure. Yeah, it's
or how your body's responding, or if anything is going negative. It is really important. But that first month, you're in every week. We're talking things out. We're talking about how you're feeling. We start you at this baby dose and we work your way up based on how your body's doing. After that, I also give you education on how to inject yourself. If you're interested in that, you can always come in every week. If you're like, needles aren't for me, they are for me. So come in. Then we come in for monthly check-ins and we really just monitor things. But during that first month, I'm a broken record. Protein, fiber, water, protein, fiber, water. And what's going on? I make people journal the first month because what you see with, the side effects that we worry about with people, it really is really linked to things that you ate, like something that you went off, like a bad habit, it was a party. I did this. It was wrong. I know. I learned. We have to go through those moments. But it's that first month is a lot of education. And I build a rapport with people because I think it's really necessary. This is a drug affecting multiple systems in your body. It's the online things scare me. Because tell me the last time you read through the warning on your prescription of ibuprofen of this.
Never.
Nobody does that. And this does affect your body. What if something goes wrong? You won't know.
Yeah. Before we give me my dose, my weekly dose, I wanted to touch base on, sorry, Alex, let me try to think what I was going to say. The creating habits, but there was something else. Okay. So real quick before you give me my drug.
Shoot her up.
This has also been linked to aging rapidly because when people lose weight fast, or if they're on the wrong dose and they're losing 20 pounds in a month, that can cause facial weight loss. So meaning your fat pads in your face. So I have big cheeks and I like my big cheeks. I wish they were big everywhere. Big cheeks here, big cheeks there. But if I lose too much weight, I get looking too skinny, and these fat pads, especially being my age, people tend to start looking older, crepey around the eyes, your gels.
Volume in your face holds up your face. You start losing volume, you start losing weight. Like I said, I like when my face is a little more gaunt because I was a round face. Yeah. But when that happens, don't worry.
Sculptra.
I got more. I got a needle in my hand and we're ready to go. Sculptra,
PRP.
Absolutely. Sculptra, PRP, my favorite. I love a natural look. I like to get the volume back. I like to have the added benefit of skin glow. All of that. There are things to do. And these things we're already supposed to be doing as we're aging.
Yes.
So they're just what we would do anyway. I'm not going to be filling your cheeks back up like the age of the cat lady, going crazy with the dermal filler. None of that. We want something natural. But we need to address things, Sculptra was initially something amazing about Sculptra is it was initially brought on for HIV patients and their hollowed out, gaunt look that happens when they lose all of their volume in their face.
I didn't know that about Sculptra. Yeah, that's interesting.
Awesome.
Yeah.
But it's natural. It's never overdone. The reason why people are always afraid of
it takes time.
Yeah.
Sculptra.
Slow
you have to be patient.
So you don't look like a different person.
I mean, I feel well, with Lexi, she's done microneedle. She's done a few things, but doing microneedle and Sculptra, it is the
100%. You're aerating your lawn and fertilizing it with those two. They're the best things to keep it healthy.
And here's the thing with Ozempic face. I hate that we call it Ozempic face.
Yeah, well,
If
we got to
you
label
lose weight
everything.
with or without Ozempic, you're gonna lose weight.
100%.
Yeah.
There's no difference between losing it naturally, losing it with Ozempic.
100%.
Your face is gonna lose volume.
But when you
Yep.
lose too quick of weight,
Yeah.
for people who are bigger and they lose, like, look at Biggest Loser we were talking about the other day. When you looked at the Biggest Loser and they were on the show for so many weeks and then they were after and they were amazing in their bodies and they were so happy, they looked older in their face because they did it so quick. They were on a time frame for the show, but because they were so much bigger. So I'm saying people who are obese, not obese with the, what's that machine that tells you you're obese?
The BMI.
The BMI.
Which is
the BMI, I'm still obese, right? So, but when you're really obese and you have a lot of weight to lose and you're starting to lose it so fast, I mean, it's like I won't even say his name.
Oh
God.
I know who you're saying.
Never mind. I don't want to cut it out. Anita doesn't deserve. Not in this year. Nope. Not doing it. Okay. Anyway.
It's when you also, because your body, it does take time to heal and regenerate, so your skin, when it does get stretched out, can we, stimulate more collagen, make it more bouncy using things like Sculptra PRP? We should, because it is too rapid a loss. You'll see it all over.
Eat a lot of protein, eat your healthy fats, maintain a diet, do what you can at the end of the day.
Exercise, water.
Yeah.
It's so important.
All right. Let's give me my shot before we're done.
This woman.
I know. I'm like, are you gonna behave or are you gonna freak out?
Oh,
She usually likes it. Okay, don't get too ahead of yourself. I need to draw it out.
Oh, okay.
You can breathe for a few minutes.
She's lifting her shirt off.
But let's get it over with.
I know. You look great. You always have.
Kidding. These are too big. I think I've thought of it.
Another study. So you were talking about the brain health.
Yep.
A study that I was reading, and not to bring it back to me, but back to me, I had mental toxicity. It fucked up my brain. It destroyed brain tissue. I'm pretty sure that's one of the effects. I got in a car accident because I forgot I was driving and just crashed into a car in front of me. I came to work crying that one day because I forgot how to drive. It was so scary. So mold degenerates your brain.
Oh, yeah.
I am so sharp now. I'm still like a little slow when I'm tired. But no car accidents.
Except for when I'm really tired and feeling a little bit off the
But there's a study, I think it has been done to completion, where they've given it to patients with Alzheimer's and dementia. And
Which I'm being perimenopausal, you get brain fog.
Yeah.
I've yet to see that clear up a little bit because sometimes I'm all, Lexi, Lily.
Well,
what is her name?
There's a difference between having a lot going on. Like, you can't avoid stress, right? Yeah. But I think if we can do something now to increase the health of our brain to prevent dementia someday, give it to me.
Well, this is what's so cool about these drugs, right?
It's so pretty too. I love the pink.
Little B12 in there.
B12 is in there.
Yeah.
I want to explain that real quick.
So good for the parietal cells. I mean,
what's parietal?
The stomach cells.
Okay.
B12 is in our gut. Like, it's where it gets absorbed. We're doing it. It helps minimize side effects. Also helps with our energy levels, all sorts of things. But great added benefit with the shot. But
for nausea, right?
You're saying a little nausea, but also energy, and then the cells in your stomach to help them adjust to the drug.
You don't remember what it said?
No, I remember, girl. Don't you worry.
She remembers.
So
I'm a weirdo.
Do you switch sides each week?
Yep, I switch sides. We never want to inject the same area. More than once.
Talking.
Scar.
I've also seen people inject it on their thigh, their arm, but I have heard the best with this. Okay, here's the thing. Angels being a baby, it doesn't hurt at all. You can't even feel the needle. Show the camera the needle. It's literally
the teeniest baby needle.
I still freak out too. I do myself, and it's like
teeny.
Yeah, maybe even had to give me a countdown.
Yeah, and
but it doesn't hurt. You can't feel it.
No, not at all.
It doesn't hurt. I just
she doesn't like needles.
Yeah,
it's weird
every time.
I mean, we just
spooky. They are.
It's just
I get anxiety every time I get Botox too.
When you're poked, it's your fight or flight, man. You're about ready to get.
I've had a lot of surgeries, and they've always had to keep poking me because I couldn't find a vein. So it's just a little PTSD.
Yeah, 100%.
And then, but when I'm getting Botox, same thing. It doesn't hurt. I'm just like,
Yeah, your nervous system, and then you tense, and then it hurts more, and it's a whole thing, But what were you just asking me? I wanted to mention. Things that we know about this drug. So tirzepatide has not been on the market too long, where semaglutide has. So something really cool is that here in 2025, like the comparison of the two drugs, the efficacy of the two versus each other, we're finally going to be in like research heaven, because we're going to have all of the research of what We have, all these people going on this drug, so many more. We get to like have a bigger population of people to study, and the things that we're talking about with memory, Alzheimer's, inflammation, cardioprotective, addiction, the ways that we may be using this drug in the future. This year, we're going to start to see a bunch of new studies because it's been the right amount of time for us to research it and peer review it. It's going to be an awesome year to find out about more of the benefits we're seeing with this drug. But I mean, what I see with my patients is all the added stuff.
Can you do online consults?
We could do like a virtual, but at the same time, I'm taking vitals every week for everyone.
Okay.
I'm taking
So it's
your
rare that you
weight.
get to-
It would be a very unusual thing if I'd allow that.
Okay.
Because it's a little, like I also, when you said, if I see someone with body dysmorphia, communication, 70% is body language.
Also, if
what I
something-
see, it's a big deal.
Real quick, someone trying to get pregnant,
No.
not at all. Do not get on this drug.
Nope. You got to be off it for,
Yeah. For how long?
at least 2 months before. We do not want to be on this drug.
Okay.
Yep.
And it makes you more fertile, apparently.
Fertile myrtle. That's what.
Well,
maybe
maybe kills your hormone dysregulation, correct?
Yeah, and what is it? Is it, like I said, this year's and the studies that are going to come out are going to be awesome, but is it that we're losing weight so we're more healthy and able to get pregnant
that
more?
was my question.
Is it the hormone, how hormones are affected with this? I don't know. I can't wait to read those articles, but definitely people, you heard this big thing, Ozempic babies, this drug you do not want to get pregnant on. It is harmful.
Okay.
It's not what we want. So I'm like, this is another thing with my consult, being in the office with me, we talk about all this. When are you ovulating? Do you have a partner? How are you guys practicing safe sex? Is pregnancy on the table? If so, you need to wrap it up extra that week and watch out and be monitoring your cycles and those things. It's important.
But I did confirm it is not like Accutane where you will have to abort the baby.
Yeah.
Just you'd have to get off it immediately.
Immediately. Yeah.
Cool.
Okay. So once you want to have your baby, we're going to wean you off.
Whoa, I've been on birth control since I was 10. I don't even know what's going to happen when I get pregnant. It's going to be crazy.
All right, Mabel, thank you so much. It's always so much fun.
I hope to see you guys in my chair. If you're interested, I'll answer all the questions.
And if you're out of state looking for a practitioner to do your whole journey, look for someone like Maeve who's informed, hands-on as fuck. You don't want to go in
non-judgmental.
And never in my chair. That's
hand-holding through this journey because it is, an up and down. So thank you again.
Yay, it's
you guys. It feels good to be back. We'll see you again next week. Don't forget to follow us on our Instagram page, It Hurts to Be Pretty Podcast. Also, please, I know that you listen and maybe share with a friend, but follow us. Following us means a lot. So not only share with a friend, but follow us on our page. So we will see you again next week.